Hello, I'm Dr. Franck Yata. Thank you for joining us for the 5th episode of our series on erectile dysfunction. But first and foremost, please make the gracious decision to subscribe to our YouTube channel, to like this video and every video you watch to support us. Also, don't forget to follow us on all our social media accounts. So, let's continue with point C, lifestyle-related causes. Indeed, your lifestyle can profoundly interfere with your erectile function. The inability to control anxiety and stress, financial, professional, romantic, or family, has a direct impact on erectile function due to its significant psychological component in the brain. Lack of physical exercise, a sedentary lifestyle, and obesity can also contribute to, if not inevitably lead to, erectile dysfunction. But the good news is that with professional help, like what Dr. Franck Yata can offer you, these problems can be resolved. It should be noted that we can also classify here pseudoerectile dysfunction, which is in fact only a lack of knowledge or education on how to proceed or conduct an intimate act with one's partner. If you don't know how to do it, a lack of confidence or self-assurance combined with a feeling of shame at never satisfying your partner can lead to a mental blockage to the point of not getting an erection. This pseudo-dysfunction does not constitute erectile dysfunction as a disease, and it can definitely be corrected with a few sessions. Therefore, remember, erectile dysfunction is a diagnosis that must be made by a professional doctor after a careful examination. 2. Psychological causes. As we've said several times before, to have a fulfilling intimate life with your wife, your mental health, or better yet, your psychological health, must be in good shape. That is, your brain must not be preoccupied with emotional burdens other than desiring your wife. And even then, this emotional charge must not be excessive, otherwise ejaculations will often be premature. We will discuss this later. So, to return to psychological causes, any personal, family, social, professional, or other relationship situation, whether financial, material, or simply emotional, that strongly and prolongedly preoccupies the brain has an immense potential to lead to erectile dysfunction. Note that the chronicity or persistence of stress is a very important factor. This psychological dysfunction can manifest itself in the form of premature ejaculation or even sexual impotence, and it can affect men of all ages. Fortunately, in the absence of underlying pathologies, this psychological dysfunction is very curable. We will therefore cite among the causes any situation of stress and anxiety, including sexual performance anxiety, depression such as loss of interest in sexuality, interrelationship problems, previous sexual impotence, mental illnesses of other origins, etc. It should be noted here that lack of sexual interest or temporary mechanical impotence due to a specific illness or disability does not constitute erectile dysfunction. In other words, we should not talk about erectile dysfunction, for example, to a sick person showing symptoms such as pain, fever, or a distressed man who has just lost a loved one, or a sick person during a convalescence period, etc. 3. Drug-related causes. This includes medications such as neuroleptics given to the mentally ill, anxious, or depressed, or to people suffering from Parkinson's disease. It also includes antihypertensives, or excessive use of phosphodiesterase type 5 enzyme inhibitors, such as Viagra. Therefore, Viagra should be taken with great caution because it can produce serious side effects, including heart problems up to cardiac arrest, loss of vision or hearing, or in some cases, priapism. Priapism is a prolonged and painful erection that can last more than 4 hours with serious complications that damage penile tissue, requiring immediate medical attention. 4. Mechanical or traumatic causes. Any mechanical or traumatic situation that directly affects the spinal nerves, for example, or the vessels or organs directly involved in erection, to the point of causing discontinuity, can therefore lead to erectile dysfunction. Concretely, this can be the case during a traffic accident, work accident, a fall, a fight, etc. 5. Causes of priapism. We haven't talked much about it. Remember that it's a permanent, painful, and abnormal erection, unaccompanied by sexual desire or arousal. The main cause of priapism is taking certain medications, including those in the Viagra family. Certain lesions and injuries of the cervical spinal cord have also been associated with the onset of priapism.